Welcome back to SL Chennai Speaks Out. Is diabetes complicated by ignorance or negligence? This is our most fiery round. It's called Crossfire. Wait and see if Dr. Ramachandran loses his coat or perhaps his shirt.
We're all standing here instead of celebrating, Children's Day, that we are talking about diabetes. There's so much of awareness, and the complications have really been so alarmingly high, fatal to that level, where I think they've been negligent. It's the negligence not only from the patients or from people suffering from diabetes, from doctors, from healthcare workers, nurses, from industries. It's from everywhere. The negligence is so high. So once if a patient comes to us with impaired glucose intolerance, why do they have to become an insulin, someone who becomes insulin dependent? From insulin resistance, they get into insulin dependence. So that's somewhere down the line, the negligence is there from everywhere, from the doctors not giving time to the patients to the dietitians doesn't know what kind of diet chart to give them. They are busy telling them what not to eat, tell them what to eat. Yeah, they have to eat end of the day. So they don't know where somewhere they completely lack, or they don't ignore the fact, and also they're negligent about the fact where they don't give importance or priority towards working on them towards controlling diabetes.
Yeah, I think the first thing is your level of assessment of the awareness is absolutely wrong. You are talking about majority of the people, a common man in this country, do not know what is diabetes. You even ask people.
We are talking about people who are diabetic, doctor, where 4 million people every year in India is dying of diabetes complication. What do you have to say for it?
The point is because these people have not been instructed, they have not been told what to do.
Whose responsibility? The doctors are negligent, the healthcare industry is negligent about the whole thing. Well, how can they die? And there's an alarming number, more than HIV. HIV is at least contagious, this one is not even contagious.
Yeah. I think it's very easy to blame the disease and the doctor. But the problem
is that I think about the negligent about the whole thing, the whole concept of looking after diabetes is what I'm talking about.
The thing is that diagnosis itself is we are not aware who are diabetic. And then who are the people who need aggressive treatment is not very well known. And even in the medical curriculum, I won't say blame the doctors, but the awareness of treating a chronic disease is very low.
When you say with the doctors, it is only negligence, doctor, because diabetes is studied from day one of medicine. Like, it's not something you have to become a diabetologist to say that, okay, someone's fasting blood sugar is higher, HbA1c is above normal to be diabetic. They can diagnose. That much they are trained in the basic medical degree to at least refer to a diabetologist or to a physician. So somewhere they are negligent, or they don't want to take responsibility of the patient's health in helping them reverse that condition.
No, the problem is that we are all trained very well in acute illnesses. We are all very good in infectious diseases.
But diabetes is something which is quite an disease which is there from day one, doctor. We hear about it, we talk about it, there's so much of awareness, and every common man knows, I would at least heard about the disease called diabetes.
No, every common man has not heard about diabetes.
I'm sure they heard. See, something at least 80%
in Chennai, 25% have not heard.
Sorry?
Chennai, 25% have not heard.
Of that word diabetes, no, you said complications. I'm sorry, it's about the, I'm talking about even the word diabetes, I'm sure everybody.
Yeah, the debate is about complication as well.
The debate is all about complication, yes. But I feel I'm coming boiled down to the basics. If you detect the diabetes only, you will find the complications.
Fair enough, yeah.
You're talking pretty long, but the sense is little less that. The reason is that you are not really sensed. Chennai is a city which has got the maximum awareness about diabetes in this country. And that is the place.
Yes, you yourself have agreed that we have the awareness, doctor. Now we are negligent in looking after.
Even after so much of awareness, as you rightly said, 30% of the people with diabetes do not know that they should have an eye examination, they should look after their feet, they should actually have
Whose responsibility? They have to, though the awareness is there, the doctors, when they come to them, or the physicians, or their own, they are negligently. The basic thing of, it's not just eye and everything, it's more about them becoming more, ending up with complications and fatal. It is so, it's quite alarming when you say that every year we lose 4 million people.
Kausala, let me ask you, there is a colleague of ours, I don't want to mention names, absolutely fit, who would go jogging 5 kilometers every morning, and one fine day he suffered a heart attack. And that was because his sugar levels were high. There were no symptoms at all. He was not negligent. He was doing his exercise, he was eating right.
We are talking about diabetes complications now, but I do take that question here. See, God didn't create us with a body which is so weak that overnight something happens, we die. I completely disagree.
You don't think diabetes is a silent killer?
There is complications which can be silent.
Is it a silent killer or not?
No. I mean, in the sense like the complications are shown. It cannot be like you are, the basic symptoms. None of it is seen, and overnight someone
Pushpa?
dies of diabetes cannot happen.
No, I don't
overnight
agree.
someone cannot die of diabetes without anything at all. The symptoms are being neglected
Pushpa, I mean,
over a period of time.
Someone who's reported extensively on this.
There are times that people land up in the ICU with a massive heart attack, and that's when they know their sugar is extremely high.
But
and
they would have ignored their symptoms. They would have ignored their, diabetes overnight cannot shoot
How
up.
can you say they ignore when they don't even know that it's a symptom of diabetes?
No,
That's
the
the
negligence
argument.
is pretty high. See, the awareness level is pretty high and they have neglected it. See, for example, here everybody thinks, most of them think, if men we talk about, which are very common with, heart attacks, they all think they are God, nothing will happen to them. Only the wife has to bring the husband saying, please look
No, but
after
Kaushal,
him.
let's be practical. Let me bring in Dr. Prema also here. I mean, people say you should go to a dentist once in 6 months.
How
You
many
don't
of
go
them
to a
go?
dentist only unless you have a cavity or some problem, extraction is required. Most people
That
will come
is
to an eye
negligence.
doctor. No, most people will come to an eye doctor only when they have conjunctivitis. Some of them will come to office also, but that's a different matter. They come to an eye doctor when they have conjunctivitis. So nobody really, it's easy to say that you should come once a year to get your eyes checked. But at the end of the day, people don't have the time, and unless they have a serious problem, that's when they go to the doctors. Because again, the common perception is that doctors, at least some of them, tend to fleece, so they tend to prescribe a whole lot of unnecessary tests. Again, perhaps to play it safe, you have the Consumer Protection Act over your head.
No, that itself says it's negligence.
No, there are times when we have also made a diagnosis of diabetes by looking at the eye, that is looking at the fundus, and when we ask them whether they have been diabetics, they are not aware of it. So I usually tell them that you are a diabetic, kindly go to your diabetologist and make sure, and next year they come back, they have not done anything about it.
You just said they're not aware of it.
She said that the patient was not even aware of the diabetes.
Yeah.
So
Yeah.
how do you think it is just
No,
it's
I did
ignorance?
tell the patient that the patient is a diabetic and the patient has to go and see a diabetologist. But they have not come back, and they come back next year to me for the annual eye checkup, but they have not seen the diabetologist.
You don't reprimand them when they come back without...
Of course, I do reprimand them, but there are cases like that.
Doctor, I mean, they don't listen to the doctors. What do you do?
How many diabetic patients really know that they should have a checkup for their eyes? How many can even afford? There are
Actually,
both.
there are patients who come in just for their routine checkup and we pick them up. We see background diabetic retinopathy and
See, there's a big difference between what you talk about seeing patients in the city of Chennai, which is very different from I'm talking about the common. This is being done talking about a common India here. If you're talking about villages, there is a complete lack of awareness about diagnosis, about these risk factors for diabetes. After getting diabetes, they do not know what they should be doing. Even if they go to the doctor will treat the acute illness of the patient. A foot infection is treated. He is never told what to do next tomorrow. You say, come back.
Only
if you have a
symptomatic
problem.
treatment.
Absolutely symptomatic
No,
treatment.
even
It's
here
absolute
she's
lack
been
of
saying
awareness.
that patients come to her for an annual checkup, which means they come. They are not negligent. They come every year. They are not negligent. They do
I
come,
am
but
talking
they
about
don't
their
know.
negligence when I tell them you should see a diabetologist. They have not seen a diabetologist and come back to me properly next year for the annual eye checkup.
No, that's exactly what I'm saying. The fact that, it's a surprise to me that people do go to a doctor for annual eye checkup, because as you said, I thought they go to doctors only when they have conjunctivitis. If they are going to doctors to check their eye, that means they want to take care of themselves. That's
But
the reason why
inherent
I
care
say.
is there in every individual. Nobody wants to,
Exactly.
get
Nobody
complications.
wants to die is true, but I think especially
Why is
with
that most
diabetes.
people? What is, I mean, the
Okay,
share of the Mediclaim market today, medical insurance, virtually everyone is taking medical insurance today. Why? Because
Yeah,
they're
they want
negligent?
to, nobody
Because
wants to
they're
die,
negligent?
they want to stay
No,
healthy.
are they taking Mediclaim policies because they're negligent?
No, because they know they are, yes, see, they know they'll end up with some complication and they have enough money to look after. But the problem is it has to hit very hard for them to look after themselves when it's the early stage where the symptoms are very minimal, where they can cope and their routine life is not being, disturbed. They don't want to make an
That's
effort
an
to look
interesting point there,
after.
Pushpa. When their routine life is not being disturbed, as long
They
as they can
don't
go
want to
along,
do it.
carry on their day-to-day activities without a problem, then they feel they are healthy. They don't need to go visit a doctor, is what most people think. That's a common thinking, yeah.
See, another thing that I want to point out is if you have a problem with your foot, or you say there have been so many amputations could have been avoided if you have enough vascular surgeons in the country. you go with a foot that has gangrene at a point when the surgeon has no choice but to cut out your leg. If you have had enough vascular surgeons in the country, this could have been prevented. Similarly, if you have had more diabetologists in the country, this could have been prevented. The whole of Northeast, if you count the number of diabetologists there, I think it will probably be a handful. That's all.
I just want to have one question. If you are a diabetic and if you know that it is going to affect your eyes and you are going to get blindness, if you know that you go into kidney failure and you need dialysis, and if you know your risk of getting a heart attack is 4 times than a normal man, do you think you will neglect it?
Kausalya?
No, how many of us, okay, let me ask this question. How many of us here know all this? Don't we know all this, that diabetes can affect the eyes? We all know that overweight is a problem, and you don't need anybody to come and tell you please lose weight and look after yourself. Nobody really bothers
The diagnostic
about
BMI
it.
cutoff is now revised to 23.
Yes, 23. And so the awareness is definitely there. Overweight, you look at yourself in the mirror, you don't need a doctor, you don't need any third person, you yourself know.
When
All
you
right.
say we know, who are the we?
No, I
So
think
very few
everybody
we.
knows. All of us know.
Who are these we?
See, overweight is visible, doctor. Visible, Sanjay. It's
But
something, it's not something.
You discount the size 0 trend in society.
No, I completely discount that size 0.
All right, we've had a in fact, the audience just itching to come in on this round, but they can't do that on this round. Stay tuned. Coming up next is Public Punch.